Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by Spamedica. Hello and welcome, Dr. Stephen Mulholland here in Toronto, Canada with Plastic Surgery Talk. Welcome to our latest installment of our podcast series. This one is on gynecomastia, male chest tissue, male breasts, an embarrassing problem with a very simple solution. If you find these podcasts entertaining, engaging, interesting, and informative, please sign up, share, and comment. What is gynecomastia? What is male breast tissue? Gynecomastia is a fancy name for unwanted male breast shape and form. The content of that male breast can be one of two, and sometimes a combination of two tissue types. It can be a fatty male breast, so it's mainly adipose, or it could be glandular, which is true glandular hypertrophy or increased glandular tissue forming the breast mound. The causes of gynecomastia can be hereditary or acquired. The hereditary causes are stronger estrogen drive, usually a hereditary predisposition to this gynecomastia, this glandular gynecomastia. It tends to be more gland and less fat because you inherited the curse of that estrogenic effect. Now, interestingly, the treatment for glandular hypertrophy or gynecomastia is going to be ascertain the diagnosis. So if you have a younger patient, adolescent, develops a little tan or stage 1 or 2 breast bud, the nipple-areolar complex is sticking out, and you're wondering, oh geez, I hope my adolescent son doesn't create male boobs, and it could be a glandular issue. And so as a family physician or a specialist seeing these patients, you want to do hormone profiles. Sometimes if the hormone profiles show a hypotestosteronism or relative hyperestrogenism, you may do ultrasounds and other scans looking for syndromes and genetic syndromes of feminization, adrenal glands, reproductive organelles, pelvic ultrasounds, CT scan of the anterior pituitary. These are more complex endocrinological and endocrine screening for glandular hyperplasia, usually in adolescence. Once you have an adult, a young male or middle-aged male with gynecomastia, you ask one simple question. Are you having any erectile dysfunction? Are you having normal sex life with normal erectile function? If the answer is yes, you can usually rule out all the other causes of hypotestosterone and relative hyperestrogenism. You still might do hormone profiles, but in general, they then have a genetic GIP of some glandular hypertrophy, and the rest are usually going to be fatty infiltrate or fatty breasts in generally someone that has some subcutaneous fat as part of their genetic curse. And often it comes with love handles, a little male pot, and some fatty breast tissue that masquerades as a male breast. And so fatty gynecomastia, glandular gynecomastia can often be two different causes, two different treatments, two different sources. But at the end of the day, as plastic surgeons, aesthetic physicians, body contouring surgeons, the patients we see are generally those that have pure adipose gynecomastia, and they just have chubby breasts that project and are embarrassing. Or they have an admixture of some glandular and some fatty tissue, and usually amenable to modern surgical liposuction techniques. So you've got a male patient with gynecomastia, and you do a palpation, and it feels a part glandular, a little hard disc behind the areola, and then a lot of fatty tissue. And so they have, a small B cup or C cup breast. Sometimes there's some ptosis or droop. And so who's a candidate then for modern gynecomastia surgery? When I say modern, more and more gynecomastia is managed without a scar, without an excision, without a true lollipop or anchor breast reduction surgery, even circumareolar or nipple-areolar incisional mamellar removal. That's getting less and less common because our new technologies are amenable to non-surgical breast reduction techniques. So who's a candidate? A male patient with glandular or adipose gynecomastia or breast enlargement who is medically well, has no contraindications to surgery, and is accepting of the risks and the modest improvements and benefits and realistic about the outcomes that they can achieve. That's the best candidate. So what technique options do we have for male gynecomastia? We can divide them into excisional options and aspiration or suction-based options. Under excision, it can be periareolar, limited periareolar and glandular mamellar excision. It can be more extended excisional treatments such as circumareola or a smaller short scar lollipop excision with or without skin. And then suction techniques, tumescent microcannula, non-thermal techniques, or increasingly in the modern era, some sort of thermal lipocontouring and coagulation where we liquefy and coagulate the gland and the fat, elicit a strong contraction, up to 40% contraction, and then remove the gland and the fat. And the leading technology for that is body tight. Body tight male gynecomastia reduction surgery can often eliminate all the scars of excisional options. Other more old school, older technologies going back to 2006 to 2010 would be smart lipo and ThermiRF, principally replaced by the more modern and successful body type bipolar radiofrequency energy systems, which are going to give you some optimal contraction as well as glandular and adipose lipocoagulation. And so, the vast majority of patients, even with a class 2 ptosis, a little bit of droop, are going to be candidates for limited incision, non-excisional, non-scarring, body type procedure. The treatment is straightforward. It's done under local anesthesia, and the amount of contraction, rotation, and elevation with reduction in glandular tissue leaves most patients extremely happy. So how's the body tight gynecomastia procedure performed? You mark out the patient's area of hypertrophy, of adipose excess, and where the glandular elements are. We use infiltration anesthesia. Generally, most of these in my office I do under oral sedation, little lorazepam, maybe some Toradol, non-steroidal anti-inflammatory, some oral antibiotic, and then we infiltrate with double-strength Klein solution, a wetting technique, into both glandular areas and infiltrate the gland and the fat. Then we do body tight thermal coagulation. We use the 2.4 17 centimeter device. Our settings are 40 degrees external, 70 degrees internal, and we provide enough coagulation to heat the deep layers to 70 degrees and get the skin up to 38 to 40 degrees Celsius, usually about 6 to 8 kilojoules per breast. That takes maybe 10 minutes. Once we've done the thermal heating on coagulation, ensuring that 40% area contraction over the ensuing 6 to 12 months, we've liquefied the fat, the small vessels, and the gland. It does liquefy a gland. Radiofrequency internal electrodes and probes will liquefy the gland to make it aspiratable. Then we go in with any aspiration technique you like to use. It can be suction-assisted microcannula. It could be PAL, power-assisted. I like to use power-assisted 3.7 or 4.0 millimeter Mercedes tip cannulas. We do power-assisted removal of the gland and the adipose tissue. And then I'll use some small SAL cannulas to do a little bit of refinement. You make sure you get enough aspiration of that glandular tissue under the nipple-areolar complex to have a nice even pinch and roll test throughout the aspiration zone. I'll sometimes then go back after the heating after the aspiration and do second heating. Heat the skin in the residual gland and the FSN, connecting the pec major to the skin one more time up to 70 degrees internal and 38 degrees external, 38 to 40 degrees, and then we've done our contouring. I do use a drain. I use small 7 millimeter JP drain inserted under the glandular tissue coming out the axilla on each side, and that drain stays in usually 5 to 7 days or till there's 3 consecutive days with less than 20 cc's in 24 hours. We do use a garment, so a tank top, limited garment, or an open neck, short bicipital garment with good chest compression, and we use foam. Epifoam, silicone back foam on top of the chest under the garment with the drains underneath. We do the foam and the garment for about 2 weeks, and then residual garmenting for the residual 4 weeks of that 6-week garmenting requirement. The drains will often come out within 3 to 5 days, or when there's less than 20 cc's on each side for 3 consecutive days. So 6 weeks of garmenting, usually back to work in a sedentary job environment in 5 to 7 days. Back in the gym doing pec workouts, pec flies, bench press, aggressive upper shoulder girdle activity in 4 to 6 weeks. How long will the results of body-tight liposuction of gynecomastia breast reduction last? How long will male gynecomastia reduction last? Generally, the fat reduction, if patients maintain their surgical weight, they don't get chubby or put on weight again. They're not going to get any more glandular collection, so the glandular subareolar tissue is gone forever. And the fat we remove through body tight lipo is gone forever as long as they don't put on weight. And so the results of the contouring reduction are forever, lifelong. With the proviso, patients cannot put on significant weight. So stay within 10 pounds of your surgical weight, you should have a lifelong improvement. The skin tightening we get from Body Tight, that 35 to 40% we get over 1 year, generally is long lasting. But as you get older, the male integument tends to get lax, 60s and 70s, the belly gets a little lax, the skin of the chest and the arm. So you may experience some ongoing laxity in your chest wall as you get older. And so we do recommend ongoing maintenance treatments that are bulk heating, thermal in nature to maintain and enhance the tightening. So bulk heating radiofrequency devices such as the Forma Plus, Venus Freeze, Pelave, Temperature Envy, the moving bulk heating radiofrequency devices that maintain collagen content are recommended about once every 3 months on the chest tissue following body tight lipo, gynecomastia reduction in males, and usually a lifelong pleasing contour improvement with tight skin is the result. The recovery following body tight lipo, gynecomastia, male breast reduction is fairly quick. In generally 1 week, you can expect 1 week back to return to work for a sedentary job. So you do your procedure, usually lasts about 2 hours. You go home 2 hours later. You get your drains out on day 3 to day 5. You're garmented. You're wearing your foam under the garment. You can wear, a shirt or a sweater or a hoodie or a work environment work shirt after 1 week. So you usually return to work in 1 week. Light activities in the gym, for instance, working on your quads, your lower legs, maybe abdominals at 3 weeks. Stair climb or elliptical, 3 weeks. Back in the gym doing jogging, pec work, pec flies, bench press at 6 weeks. So 1 week, return to a sedentary job. If you're a laborer, construction worker, heavy worker, you're going to need modified duties or back to work in 2 to 3 weeks, depending on how heavy a lifting you need to do. Body tight, lipo, and male gynecomastia reduction is uncomfortable, more like a bruised discomfort, like you worked out in the gym and the next day of that lactic acidosis, a little stiff, a little sore, but not terribly painful. So I would tell most guys it's about a 4 out of 10 type of pain. More like a muscle ache or discomfort and a bruise, so reasonably tolerable. Usually don't need narcotics post-op. It's not that painful. We use non-steroidal anti-inflammatories like Toradol, which is ketorolac, which is above Celebrex and above Naproxen in terms of non-steroidal strength. And usually you can be back to a sedentary job and a desk within 5 to 7 days when your drain is out. And discomfort is more of the adjective I would deploy rather than painful. It's uncomfortable and discomfort that you experience in the name of a flat chest, so usually more than worth it. One of the things that turns many male patients off who have gynecomastia, they go online, they see all these breast reduction scars, the circummalar, the lollipop scar, the anchor scar, and if you get any kind of keloid scar forming or raised unattractive red scars or widespread scars, you'll be just as self-conscious with the scars as you were with the gynecomastia. So some guys just say, I'll live with what I got. The nice thing about body tight lipo, gynecomastia, breast reduction is the scars are tiny, 2, 3 to 4 millimeter well-placed access ports on either side of the breast, invisible if you've got some hair to your chest, and generally well tolerated even if you have hairless skin on your chest, because we can do laser treatments on the scar, we can inject the scar, we can modify the scar qualities that leave most guys completely either unaware or certainly not self-conscious about the access ports we need to perform the body tight breast reduction lipo procedure. Body tight lipo gynecomastia breast reduction is not risk-free, but it's greatly risk diminished. It's performed under local anesthesia, so you don't need a general anesthetic. It's done with local freezing, and so the risk of having painful or risky nerve blocks, again, is eliminated. It's done as an outpatient, so you're not staying in a hospital. The risk of bad infections from highly resistant organisms is extremely low, if not zero. The risk of having some reaction to aggressive general anesthesia and arrhythmias or cardiac, pulmonary complications are low. The risk of a blood clot and a pulmonary embolus is very low because you're active very quickly. So I would say your risk of a serious medical complication is not zero, but pretty close to zero with outpatient ambulatory body type lipo, gynecomastia, breast reduction. The basic risk, the risk of infection that's usually treatable, the risk of a mark or a scar, the risk of asymmetry, one breast is flat, one's a little fuller, the risk of fluid collection called seroma, all these are annoying but manageable, and they're in the order of 2 or 3%. So in terms of accepting a procedure, most guys find this very acceptable, and 90 to 95% of all patients experience no complications. They have a predictable recovery that gets them back to work within a week, and generally within a month you could go on a vacation, have a flat chest, and not be vexed by the curse and the embarrassment of male breasts. Very common question I get from male gynecomastia patients. Doc, can I do something else with this? I'm already having the recovery. It's a natural to combine with other procedures. Of course, if you're doing body type lipo gynecomastia reduction here, if you've got a little love handle, a little pot, a little double chin, we can do body tight on other body areas, and we can give you a better figure, a more athletic looking shape, more toned, more cut. So additional body tight lipo reduction procedures. You can combine body tight gynecomastia lipo reduction with laser hair removal. You can combine it with Botox, with injectable soft tissue fillers. You can combine it with little mini lifts, a little mini neck lift or guy lift with a rhinoplasty. So yes, you can combine it with other surgeries. The most common combination is just body tight lipo in other body areas to get even better contour in other areas other than just your chest. Okay, now for the big finale. Doc, how much is this? I love the before and afters. I love the concept. I love what we can do with this body tight without scars. What's the cost? So the average selling price or price point for gynecomastia reduction, depending on the city, depending on the market, depending on the surgeon, depending on the price point of that practice, is going to be somewhere between $6,000 and $15,000 for male gynecomastia reduction. Now, the value add to having a scarless approach with body tight, thermal coagulation and tightening without an areolar incision actually makes that more valuable, and sometimes you can charge more. The average selling price of my practice for body tight lipo gynecomastia reduction about $9,000 or $10,000. I can do that in about 2 hours. Patients are super happy because they get tight, flat skin without laxity and without ptosis and without the debilitating and often very embarrassing and disfiguring scars of breast reduction and mastopexy. So this is an example of where technology innovation InMode's body tight with bipolar radiofrequency thermal coagulation has made a significant difference in the clinical opportunities I can offer to patients with the scarless breast reduction, which for males, because we often are shirtless or topless, which is one of the reasons you're doing it, is critical to the success of any procedure you're going to be offering patients, a scarless body tight gynecomastia breast reduction. Again, thank you for joining me, Dr. Stephen Mulholland, here in Toronto, Canada, on Plastic Surgery Talk, with our latest installment of our podcast series, which is on gynecomastia, specifically body tight lipo reduction of gynecomastia. I hope you found this enjoyable, entertaining, and informative. And if you've had, please sign up, share, and comment. We'll see you next time.